We are live as always on Pop One's Health and Community Show, Tips for the Week show. And I don't see me. Can you all
No,
see
we
me?
Your
I
camera
don't know
cannot
what
see you.
No,
what
Your
happened.
your camera is
Huh?
off.
I don't know how to start it back up again.
You see the
Do
little
what now?
camera at the bottom? You see the little camera at the
Uh-huh.
bottom?
You should see
Push-
share your screen. Yeah.
Is that it?
There you
That's
go.
it.
You're
There
back
you go.
on now.
Now look at this here. Who was the communist spy that said you can't teach an old dog new tricks? Who said that? And thanks to Michael and to Cheryl and to Susan, I learned something. Once again, we're on Pop Bonds Health and Community Tips for the Week. As I always say, it is our joy to come to you every week to give you enough health information that you can choose to live a healthy lifestyle, or if necessary, make informed healthcare decisions. And then community tips, community news, a lot of things going on that would benefit you in the community. And my grandmother taught me that before you do anything, you need to let the Lord guide you through the Holy Spirit for a decision. And we have so many people that want to be, and this is such a blessing that God has blessed this. My grandmother used to say, you know, God doesn't want your sacrifice, He wants you to be obedient to Him. And so it was a big leap for me to do this here program, as challenged as I am technologically. But God has, I stepped out on faith as I always do when God makes it plain. And so this show has been such a blessing that we are being booked out. But there are a number of organizations that have vital messages that they want to get across. And so I've been thinking about doing a pre-show to the show, no more than about 10 minutes, 09:50, for those organizations to come on and give information. There are a number of organizations that I'm highlighting. One is the West Central Georgia Cancer Coalition. The other is this pandemic has hurt this community economically, and food insecurity is rampant in the whole 16-county River Valley Regional Commission. So I'm going to highlight that. And any other, to be perfectly honest with you, any organization that has been in the community and doing good and need to get some information out. And I always say that the organizations that are working for you, West Central Georgia Cancer Coalition, everybody knows, she don't have them on now, but the lady with the glasses, everybody knows the executive, there she goes, now we know who you are. The executive producer.
I was incognito.
of New Horizons Behavioral Health. And you know who I didn't get on, Susan? I forgot Dr. Pitts. I wonder if we can get to your
Well,
connection.
you've already gone live. You'd have
Okay.
to end the live broadcast and get her back in. And
Well, I don't want to do that. That's my head and not my heart, Dr. Pitts, if you're there. Just anything. I apologize. I'll give you a call later. I apologize. But Tree of Life Healthcare, those organizations, out of the goodness of the heart, the mercy of the good Lord, they provide, and they've combined New Horizons Behavioral Health and Tree of Life in integrative care to be a one-stop shop for your behavior or your physical needs. And you know, we have we're fortunate enough to have guests on our show, but I'm going to pass the before I do that, a friend of mine who was my grandmother, my biggest all-time favorite, biggest mentor. But another young lady, Dr. Leon Glasser, if you Google her name, you see for 46 years she's been involved in patient advocacy. She called me on two issues that are vitally important that deal with individuals who need help, who are underinsured, have no insurance at all. And there's one that pertains to all of us. The one I'm going to start out with is the Senate Bill 46. It's the pharmacist authorization legislation for COVID-19 vaccinations. Governor Kent did an executive order, but I hear now that it needs to be followed by legislation. And so you want to know something? We're going to need more than the health department. In fact, I'm dealing with going to have a meeting with some good nurses to get a group together of nurses to help with the vaccination. So your regular pharmacist knows you, and I go to get my flu shot. And so why not? But, they have to go through legislation. So that's Senate Bill 46, we're going to ask you to call and support. The other is House Bill 164. And a lot of patients, and I'm sure that Michael and Cheryl know that there are many patients who have to take what's called specialty drugs for cancer, for lupus, for multiple sclerosis and things. And they don't just have to pay a copay, they have to pay part of the cost of the medication. Unfortunately, that's a drain. Battling the illness and then financially as well. Well, what House Bill 164, the Prescription Drug Consumer Financial Protection Act, will do is that the physician can apply, call a 1-800 number, and ask the pharmaceutical company to give a rebate or a discount. That rebate or discount needs to go directly into the pockets of that patient. Unfortunately, I'm hearing that does not always happen. So it will allow that patient to pay for the medication. Unfortunately, like I said, with illnesses, I know Cheryl's going to talk about a lot of the programs that she has taken upon, that God has directed in his mercy to direct her to do. But this House Bill 164 is extremely important for us to call and let the legislators know. Cheryl's talking about her phone, and look at mine. For the legislators to vote on, and also for Senate Bill 46. Now, with that all being said, I'm going to pass the baton to who, the what, the lady with the what? Glasses, Susan Gallagher.
Let me put my glasses on so everybody recognizes who I am. Good morning, Facebook family and friends, and greetings from New Horizons Behavioral Health on behalf of our Executive Director, Ms. Andrea Winston, and also on behalf of our integrated healthcare partner, Tree of Life Healthcare. Sending you warm greetings on this cold morning, and so glad you could be with us here today. Remember, if you need behavioral health care services, New Horizons is at 706-596-5500. And during the COVID pandemic, we're offering telehealth, telemedicine services to meet your needs. So thank you again. Thank you for making this possible, Pops.
Well, let me tell you, Susan tickles me. See, you ever see the cartoons or Superman where she says, this way she is.
Change my identity.
My name is Susan Gallagher. My name is Susan Gallagher. Yeah, so Superman's voice changes when he. So my guests are two. We have Miss Cheryl Johnson from the Executive Director of the West Central Georgia Cancer Coalition. And Michael, please give me Nwangbo. Please help.
It's Wobo. I'm sorry.
Wobo. Michael Wobo. I'm going to write this down. Thank you. Forgive me for mispronouncing. Whoa.
Okay.
Well, there we go. And I'm going to ask Cheryl to, it's not repetitious, but people need to know who you are, what you do, contact information, brick and mortar. And Michael, if you will follow suit after Cheryl.
Awesome. Good morning, Facebook family, friends, and Susan and Pops, thank you so much for providing this opportunity to me or to the Cancer Coalition to be able to share with the community all the various things that we do and the great work that we do here in our community. We serve 13 counties. We go as far south as Sly County and as far north as LaGrange. In the Troup, Meriwether County area. And then we also cross the river with our neighbors over in Lee and Russell County. And so there are 13 counties. We would like you to go to our website, wcgcc.org, to find out a little bit more about us. But Pops, we have some great programs that are ongoing and that are coming up. But let me first stop and just share with the Facebook community what a blessing you have been to you and your wife have been to the West Central Georgia Cancer Coalition. So in January, I put out into the atmosphere that we that I wanted to have a serenity room for cancer patients, for those persons who are going through life when life happens, and just a place of serenity, a place of peace. And so after our Facebook Live, Pops called me and said, let me see what you're talking about. And do you know that same day he showed up? He's not, talking the talk, he walks it. And he actually came and said, you know what? He picked up the phone, called some guys, and in less than 3 days, our Serenity Room was painted a lavender color,
Wow.
a color
Wow.
that's so peaceful and serene. And so that putting it out in the atmosphere, it is going to come to fruition this year, 2021.
Yes.
But we are in the process of having a Serenity Room for cancer patients. And so we're going to be coming back asking for donations, that cash, as Pop says, but also, if there's some things that are really nice, from signs that are talking about peace and serenity and those things, because this will be a community room for cancer patients to get away from the medical facilities, just to have a community area. And we will be following COVID guidelines, but we're praying that we will be at a place where the numbers will be down, but we will be following CDC guidelines. So thank you, Pops, and to Miss Barnes.
The banker.
We want to thank them for allowing the banker. That's right, for helping us start the dream that I have for the Serenity Room for those cancer patients. Not just women, it's women or men. We'll be developing a time slot, when people can come in, but it's all in the beginning stages. But I just wanted to publicly thank Pops for buying into my dream and putting his money where his mouth. Is that the correct words? I think I'm saying. But yeah, he's great. I really appreciate that. And so that is something that's coming up. We also have a survivorship program that we're starting again this year, although we know there is COVID, but cancer doesn't stop, exercise doesn't stop, because we know that that's helpful, in your process of healing and so forth. And so with Insane Fitness, we will be kicking off March 1st, the survivorship program. The owner, Mr. Darius Miles, is a certified cancer exercise specialist. And so for the first 15 cancer survivors who register, but you must have permission from your physician. Because it will be, some talking about range of motion and those kinds of things. And so that survivorship program will kick off on March the 1st, and you can give my office a call or just call Insane Fitness if you're interested in being a part of that survivorship program. We've been doing this program now 5-6 years. We started with the YMCA. We were working with another gym, Uncommon Athlete, and now we're bringing on board our Insane Fitness partners. And so we're so excited about that, where we're able to, help those cancer patients, survivors. Yes. And then we also, and this is ongoing, and we're going to start a year-long campaign for our Neighbors Helping Neighbors. So we'll have a goal, and we're asking people to donate. It's not just during Paint the Town Pink time, because that's the charity of choice for Paint the Town Pink, but our Neighbors Helping Neighbors is a program that helps cancer patients when life happens that are in active treatment, help them with their lights, their gas, their mortgage, transportation assistance, those daily basic living expenses, as I say, when life happens. And so you can't predict, you don't have a bank account, you don't have a savings account for cancer, you don't have a savings account for those illnesses that take place. And so the copays increase, there's increase with, just the various things. And so that's what that Neighbors Helping Neighbors Cancer Assistance Fund is for. And we work very closely with the John B. Amos Cancer Center. We work very closely with the hospital in LaGrange. We work very closely with the hospital in Noonan. If someone lives here within the 13 county area and they're getting their treatment at the John B. Amos Cancer Center, or they're having to travel to Atlanta or Noonan or what have you, we're here to help them when life happens. And last but certainly not least, we have a breast cancer license
There we go.
program where when a person purchases a breast cancer license tag in our community, that money comes back. You know, you have all these tags and you really don't know where the money's going. Well, I can truly say for the past 10 years, we have been a recipient of the breast cancer license tag dollars. This year, we did such a great job. They reached out to us and said, hey, we're going to just continue the work that you're doing. And so we received in November a $50,000 grant.
Wow.
Yes.
Wow.
$50,000 to help the women and men in our community who need assistance with their mammogram or a biopsy or ultrasound or what have you. We have a clinic every month with Dr. Kenneth Smith at the John B. Amos Cancer Center. And those monies, Dr. Smith donates his time. That's why we're truly a blessed organization, because we have so many people that are donating their time, their services, their money. But this particular clinic is for those women and or men that are uninsured and underinsured who need a mammogram, who has a problem. It may be a young lady who's 23, 24, who doesn't have insurance, who finds a lump and she needs to get in, who doesn't have a healthcare provider. We utilize Dr. Smith, and then if there are other healthcare providers in town who have a patient who doesn't have insurance, who needs to be guided through and need that assistance, we can do that. So let me say, no one in our community who cannot afford a mammogram, who cannot afford an ultrasound to get to diagnosis or non-diagnosis of breast cancer should be in need, because that's why we're here. The West Central Georgia Cancer Coalition, we're here to reduce the burden of cancer in the communities we serve. We are truly neighbors helping neighbors. Thank you.
I'm telling you, I just want to make a little comment, is that I'm obedient what the Lord tells me to do. And I think I told you I had to come to the bank there, Mrs. Barnes. You understand? And so, but you want to know something? Those two young men as well. You were there when I called them on the phone, and look how God works. You knew both of their parents and but God works God is way light years ahead of us on things. I've known Chris for years, never knew. And you with Quam's, I'm saying it right this time.
Yes.
Kwame's mother. With Kwame's mother. And so you see how God works when you are obedient. But obedience is the key. And that's exactly what you just got finished telling our Facebook audience, Cheryl, is what I would like for you to come sometime on. We have program, and it just took you just a little bit less than 10 minutes to do that. So it's just right for you to come on and just remind people all that's done, because you are right. Cancer can be a lonely battle. Both my mother, my grandmother, and my sister died of cancer, and it's a thing with me. I want people to know that cancer and early diagnosis is the key, and not being afraid, like as some people are, to go see about to hear that C word, because it's not a death sentence. And all the work that you've done and that Michael's doing is just awesome in the community. But it takes the community to also make sure that you all are sustaining and doing what you're doing. So I do want you to come on the show, just in between things. We start at 0950. You do exactly what, and I will encourage people. You want to know something that made my heart and my wife's heart feel good. And from the Barnes family, my wife, I'll be seeing you this week. Now, these young, now I want to tell you something. The price, the only thing that's remaining now, it was $1,400. It's down to $650 to finish it out. And then if we can get some donations, that's the floor. just because
Yes, sir.
the color that you picked out, it is so calming. You were
It
so
is.
right about that.
Yes.
But $650 for a place where, and I know I'm a nurse, and I know sometimes individuals need to be around individuals who are also going through what they're going through, where family members love them, but may not experientially really know what they're going through and feeling. And just being somewhere or somewhere where you can walk away from everything and just
Yes.
sit in that room and show the color of that room. I had to get out of it because I was feeling so good. It put me in a contemplative mood. You'd have to call the, you would get ready to have to call the popo to get me out. Be out. And we have here also
Absolutely.
Michael. Michael, we just love you. You gave such an excellent presentation. And I look through this presentation too, and it's just off the chain. So would you first of all let everybody know where you're at, brick and mortar, how they can contact you, and then you can go into that marvelous presentation that you have today.
Okay. Well, I want to start by thanking you, Pops, for allowing me to come to your program. You know, since this pandemic, for me to do what I do, it has been, you know, to say the least, challenging, you know, because you can get in touch with the community like I used to do what I'm supposed to do. But with these programs like this, I can reach, you know, people, you know. So I just want to thank you for allowing me to come to your program. For folks that don't know, you're welcome. For folks that don't know who I am, my name is Michael Wobo, you know, so phonetically it's spelled W-O-B-O. So it rhymes with hobo. Wobo. Makes it easier.
I'm going to remember that, Michael. I won't butcher your name next time.
So, an oncology outreach coordinator for Piedmont Columbus Regional at John B. Amos Cancer Center. So part of my job is to bring cancer awareness to our community, and also, I mean, through education, and also put together screenings, cancer screenings all through the year, different cancer screenings all through the year. So that's basically what I do. Today, I'll be talking about a specific cancer. However, before I dive into the presentation, I want to talk about a screening that we have coming up.
Sure.
So next month is Colorectal Cancer Awareness Month, and every year for the past, I don't know, 6 years, we've partnered with the great West Central Georgia Cancer Coalition, Ms. Cheryl, to bring to our community a free screening program for colorectal cancer. So the screening is so simple, you know, is a fecal test, a fit kit that you pick up from us and take it home and collect stool sample. And we're not talking about scooping up anything. We're talking about just a little stool sample and put it back in a package, already stamped envelope that we'll give to you, and drop it off, you know, at the post office or in your mailbox and raise the red thing, and it gets back to our lab. We'll process it and we'll send you your result in, you know, maybe a week and a half or two. You know, so is a test that traces, you know, like a microscopic evidence or presence of blood in your stool, which we know that physiologically when you have maybe a polyp, you know, in your GI tract, or, you know, malignancy, you know, it secretes some kind of blood. So this test detects that, and if it comes back positive, that does not mean that you have, you know, colorectal cancer, or colon cancer, or rectal cancer. That means there's something suspicious going on, secreting blood in your GI tract. So then we have to further investigate what's going on. So we'll refer you back to your primary physician if you have one. You know, if you don't have one, then we can, you know, help navigate you through the system where you can get the necessary follow-up treatment that you need. So we'll
Michael,
have that.
And that's awesome, because my grandmother and my sister died from colon cancer. Didn't know, and so they were having problems. You know, the second site of metastasis is the liver, And so what you're talking about is vitally important because you can go for a long time and not even realize when a test that is as easy as you are making it, it's really easy to pick it up, collect a sample, and then mail it in. It's just awesome, but it could save your life. Cheryl?
I just said yes, everything is all free. There's no,
It's
and
free.
again, our community, we're blessed because, we have funds available to help take care of this. And so, Michael, I'm glad you brought that up because I thought about that during, right after my presentation. So it's a great collaboration that we do have.
That's right. So this year it's gonna be a little, special, if you will put it that way. Because of COVID, we usually we schedule events in different places all over town so we can bring the screening to you, for convenience. But due to COVID, we can't do, those kind of gatherings anymore. So, the only way you can get it, I'll give you all my telephone number. You can call and we'll fill the forms over the phone and then schedule a time for you to come by and do a drive-through pickup at the cancer center.
Oh, that's great.
So once we that pickup, I'll be down in the drive-through waiting on you. I'll just give it to you through your window in the car where you don't have to come out.
You can't beat that.
That's
you
right.
can't beat something like that. Now, would you give everybody, again, your brick and mortar, your phone number and all that so that they know how to contact you?
Okay, so our physical location is John B. Amos Cancer Center, is 1831 Fifth Avenue, 5th Avenue in Columbus. My telephone number is 706-321-6603. I can repeat it, 706-321-6603. Now you give me a call. We'll fill out the form over the phone and schedule a time for you to drive through and pick up your kit.
Great. You can't beat that. That's awesome. Awesome.
So I can go ahead and dive into the presentation.
Yeah, because this is Gallbladder Cancer Awareness Month.
Right.
This month is Gallbladder Cancer Awareness Month.
And if I can highlight, I appreciate Cheryl, you and Michael coming, because each month a specific type of cancer is highlighted. And what you two are doing is you're letting individuals know that don't be afraid. When I was growing up, we used to say, it's cancer. Now you can say cancer because there's nothing to be afraid of anymore. And it's only through all the research and individuals like yourself who are locking arms and helping many individuals. And when you touch individuals, you touch families, and I appreciate y'all. And I appreciate y'all coming on. Y'all thanking me. I'm thanking y'all for getting the information. And I thank above all the good Lord for his mercy and his kindness. And so, gallbladder cancer, let's hit this bad boy.
Okay. So the month of March and February is also Cancer Prevention Awareness Month, which is very important. When we talk prevention, we talk about screenings, because we know one thing we know for sure when it comes to the big C, the cancer, is if you catch it early enough, you stand a chance of either beating it or having a better prognosis, surviving it. If it's caught later, it becomes more challenging.
Right.
So that's my prevention tip for the day. I'll end it at that. However, February is also Gallbladder Cancer Awareness Month, and also bile duct cancer awareness. So both of these diseases are kind of rare, but we see more gallbladder than we see bile duct. So I chose to talk about gallbladder today. Okay, so let's go on. So what is gallbladder cancer? So gallbladder cancer happens when, or any other cancer happens when, normal cells in the gallbladder, changes into abnormal cells. And
Michael, if I can stop you for a minute. Susan,
Yes.
you're advancing the slides.
Yes, and if Michael would tell me next slide when he's ready to go, I'll move
Next
it
slide,
on.
right.
Okay. All right, next slide.
That's the next slide then, I think, is what he's talking about
I
now.
think we're on the next slide. What is gallbladder cancer?
No, it's not showing up on the screen.
What'd you say,
Okay.
Cheryl?
It's not showing up on the screen. It just has the
Right.
gallbladder cancer with the green
Right.
ribbon on the screen.
See, and
Okay.
that's the, so, and that's the problem, and that's the problem. Is you want to something that's not Susan, but there seems to be a delay whenever you can't show slides. So what would make it easy then is just for you to read it all. And this next
Okay.
time we'll be prepared for the thing, because it's always not Susan, it's everybody that tries to advance the slide when the person is not advancing it himself
Okay.
or herself. So just
And
read
let me
this.
try back to share my,
Okay. You can try one more time. Let's see.
are you seeing that?
Yep.
Yeah.
But
you do.
Okay.
it's not legible.
Okay.
So let's just let you read the slide, Michael. You just
Okay,
read the
I will.
slide and we'll get the information out.
Okay. So we talked about, you know, the cells growing out of control. That will make it, you know, cancerous. So to describe gallbladder is a small pear-shaped organ that is tucked in right underneath the liver. You know, it's like a pear-shaped dark organ right underneath the liver. And the gallbladder stores bile. That's what it does. And what does the bile do? Bile is a fluid that is made in the liver, and it helps the body break down fat. So that makes it, you know, very essential in your, you know, in your biology.
Right, it does.
Function. Yes. So most people with gallbladder cancer have or have had another gallbladder condition called gallstones. That's what we all are familiar with. You know, so when a lot of times, you know, for you to have that gallbladder diagnosis, you actually, one of the symptoms will be the gallstones. You know, you start feeling, and they have to remove it surgically. So what are the symptoms of gallbladder cancer? Early on, gallbladder cancer might not cause any symptoms. In many cases, gallbladder cancer is found unexpectedly. You know, so incidentally, they find it since it doesn't give, you know, put out any symptoms. You don't feel it, you don't have any symptoms, so you don't know you have anything going on down there. So unexpectedly, you know, when a doctor takes out your gallbladder to treat your gallstones, that's when most of the time they notice the malignancy in your gallbladder, you know, trying to take out your gallstones. Another way that they incidentally, you know, discovers gallbladder cancer is during scans. You know, you might be having stomach pain or whatever that led you to go get a CT scan or an MRI, and then they see something going on in your gallbladder. That's right. Incidentally, you know, and I've seen people, you know, fall off of a ladder fixing their roof, and they go get a CT scan, and they do a whole body, and there you go. They find out that they have something going on, you know, with their gallbladder, you know. But a lot of times, by that time, it's probably already too late, you know, at stage, you know, since it doesn't put out any symptoms.
Yes.
But however, when they do put out symptoms, those symptoms will include belly pain, especially in the upper right side or upper middle part of your belly. Then you start experiencing loss of appetite, nausea and vomiting, weight loss. You start experiencing jaundice, and jaundice is when your skin and the white part of your eyes turn yellow. You know, that's evidence that something is going on. However, the fact that you have those symptoms doesn't mean that you have gallbladder cancer. You know, those symptoms can arise from, you know, several other, you know,
and any other
conditions or
conditions. But that's why what you stressed early on, Michael, screening is extremely, extremely, extremely important. And so I can't emphasize that more to individuals in the community. And the 3 stages of wellness that we teach us in nursing school. One is education, which is what you're doing now. Second is the education, is the emphasis on screening. And then the third is adequate follow-up. Those 3 things, education, screening, and follow-up, are the most important things. And so I just wanted to thank you again for stressing how important screening is.
That's right. But I want to add to that. Unfortunately, for gallbladder, there's no screening for it. So most of the times, it's an incidental finding. You know, we're looking for something else. You know, here you go. Or we're trying to extract your gallstones, and here go the gallbladder in there too. You know.
But that's why I like your slide, because if a person is having those things, loss of appetite, nausea and vomiting, weight loss, and pain in the upper right side of it, when your body gives you indications, and good Lord made our body so that it will do that, that should prompt the person to go somewhere and get some kind of screening early on. But thank you for that. Yeah, and I'm glad that you have these symptoms, because it does alert people early on. If you start, don't wait and suffer with something for months. When you initially start to feel something, go see about it.
Yes, you know your body more than anybody else, but when you start having vomiting, you know, and sudden weight loss, you need to go see your doctor. Don't
right?
You know,
that's exactly right.
Move. So, what are some of the treatments that you can receive when you have gallbladder cancer? So, typically, you know, since we extracting your gallstones, we extract the gallbladder cancer too. So surgery is number one, you know, thing to do. And secondly, you receive chemotherapy and then radiation therapy. So gallbladder cancer can sometimes be cured with treatment. This is most likely when the cancer is found at an early stage. So you can use the word cure when it comes to gallbladder cancer, unlike a whole bunch of other cancers where you can't use the word cure. But for this, you can actually do if if it's caught really early. They do the surgery, do the treatment, you can go on with your life for normally without ever having to worry about gallbladder cancer. But often gallbladder cancer is not found in an early stage, of course. If your gallbladder cancer cannot be cured, your doctor can do other treatments to help you with pain, with the jaundice, you know, with all the symptoms that you are experiencing. So that brings us to the last slide that says what happens after treatment. Because after your treatment, your doctor will check you every so often to make sure that you're good, make sure there's no reoccurrence. And one way that they do that is through imaging. They schedule routine CT scans. I don't know how often. I think in the beginning they make it more often, then after a while they start, you know, stretching it out. But they have to screen you every now and then to make sure that there's no reoccurrence. And then secondly, if you start having those symptoms again, of course, you have to go see a doctor because it might be a reoccurrence.
Well, I'm going to tell you something, Michael. This is really, I'm getting a lot of good information. People who are, I think, Cheryl, you will know some of these people. Ms. Gloria Richardson saying thank you, and Gwendolyn McIntosh is a nurse for a long time. I used to work for Gwen. She used to be my supervisor as well. Says thank you, Michael. Appreciate you and all you do, and Cheryl. So you see, people really appreciate all of the work. And my nephew, Miss Gloria Strode, and Dr. Xavier McCaskey, real good compliments. And eventually, I'm hoping that I will have somebody show me the technology where we can answer some of their questions as we're going along as well. And Cheryl, did you get ready to say something? Or are you going to get ready to say something?
No. I just said that it was a great presentation,
That was a great,
Michael, and just a simple, cut and dry, exactly to the point, and your point well taken about the screenings, and that's why we collaborate so well, is because our prevention is screenings, and we do know that there's screenings for, the breast, the colorectal, as well as the mammograms and cervical. So those are the ones that we focus on and help collaborate.
now I'm going to make you
the John Biemis Cancer.
feel good, Cheryl. I'm saving this till last. I'm going to make you feel, and it's going to make Michael feel really well, Susan, Dr. Pitts, and Andrea. Right after your show, later that, actually it was the afternoon, but she had tried contacting me earlier. I got a call from a lady from Camden, New Jersey. And this lady asked me about cervical cancer presentation that you gave. And I know you're going to be shocked. I've been keeping this. I've been fighting myself to keep you from giving you this good news. She called about her daughter. Her daughter had been complaining to her and has been resistant. When she watched the program, she made her daughter go to the doctor, and they referred her to an oncologist. Don't that make you feel? I've been bouncing off of the roof. Didn't I mention it? I mentioned it to you, didn't I, Susan?
Wow.
That's what this
God
program, Michael, you see, is all about.
That's
Camden, New Jersey.
Wow.
Wow.
You have a
We're
Got
all
a national
No,
impact.
but just think about
absolutely. And
just think about that. And you want to know something? One of the things, as always, as nurses we know, as healthcare professionals we know, people don't know their bodies. The diagram that you sent, that you made, was awesome. You did an awesome program. But those are the kinds of, I just thank God that for all of you all, for you, Susan, for Andrea, for Dr. Pitts, for you, Michael, for everyone who comes on, to have a show like this here, because it's life impacting. I'm saying it's all in the bucket. It's getting information like you just gave out, Michael, just now, about gallbladder cancer, and Cheryl that you gave, and everyone, and Dr. Pitts gave a presentation. It's really getting the information out to people so that's easily accessible to them. But Cheryl, I knew that would make your day, and
it really does. I mean, and that's what I've always said. If we can just save one life, we have done what God has asked us to do. Absolutely.
So it's more than just a life, because every life is a blessing from God as well. But look how it impacts family.
Absolutely. Yes.
My grandmother's death and my sister's death, both of those things have just impacted me, impacted the entire family. And so I wanted to bring a smile to your day today.
Well,
what an excellent presentation it is, and and I'm not bragging, I'm just saying the fact how beneficial health-wise this program is for getting the word out. Camden, New Jersey.
New Jersey. And if you know her, please just let her know. I'd love to know how things transition along.
I will do that. I will do that. And Michael, thank you today for what you done. And I would like to also repeat. Oh, it's my pleasure. You know what, something? We all should feel blessed whenever you are a channel of God's love and mercy. Michael, you, Cheryl, you, Susan, you, the lady with the glasses, me, Andrea, Dr. Pitts, we should feel when God can choose you to do something, it's a blessing for the whole day. But I want to share that with you, Cheryl. You did an excellent.
And my motto is that I love to say that I'm blessed to be to others. I am blessed to be a blessing.
I like that. And she's the one that coined what we do here, edutainment, by the way. I want to steal that. She's the one that coined this show, edutainment, because we educate, inform, but we also cut up a whole lot too. We also a lot. But I want to repeat for my friend Dorothy Leon Glasser, who I hope we can get her to come in before the legislative session is over. on House, but I didn't give her contact information. If you want to know about House Bill 164 and Senate Bill 46, you go to www.rxinreachga.org. That's www.rninreachga.org. And that's support for Senate Bill 46 and House Bill 164.
And
Awesome
Pops,
show.
that is for the state of Georgia, or is that a federal?
That is for the state
Is that for the state of
of
Georgia?
Georgia. This is
Georgia.
all.
Okay.
Yeah, this is all for the
Yes.
state of Georgia. Thank you for
So we definitely
making that comment. Very two important bits of legislation for our people to step in. Hey, I know I'm going to have y'all back every second Monday. I'm going to be with the lady with the glasses. It's always a delight to be with here. I miss Dr. Pitch. I'm going to have to apologize. There you go. I have to apologize to Dr. Pitch for just being forgetful. And thank you to Andrea. And so until next time, I'm going to see if I can correctly log out now. Let me get my arrow up there to that thing up here somewhere. Where it's at? Right over here. Until next time, as I always say, please be good and kind to yourself because God loves you. God bless you.
Thank you.
Bye, y'all.
Bye,
Thank you.
everybody.
Bye.
Bye, Facebook family and friends.
Goodbye,
Bye,
Facebook
Facebook
family. Thank you for
family.
tuning in.
Bye.
Thank you much. Bye-bye.